Guillain-Barré syndrome. Guillain-Barré syndrome is an uncommon problem where your body's resistant framework assaults your nerves. Shortcoming and shivering in your furthest points are generally the primary indications. These sensations can immediately spread, at last incapacitating your entire body. In its most serious structure, Guillain-Barré syndrome is a health-related crisis. The vast majority with the condition should be hospitalized to get treatment. The specific reason for Guillain-Barré syndrome is obscure. In any case, 66% of patients report indications of a disease in the month and a half going before. These incorporate respiratory or a gastrointestinal disease or Zika infection. There's no known remedy for Guillain-Barré syndrome, yet a few medicines can ease side effects and diminish the length of the sickness. Albeit a great many people recuperate from Guillain-Barré syndrome, the death rate is 4% to 7%. Between 60 to 80% of individuals can stroll at a half year. Patients may encounter waiting impacts from it, like shortcoming, deadness or exhaustion. Indications. Guillain-Barré syndrome frequently starts with shivering and shortcoming beginning in your feet and legs and spreading to your chest area and arms. In about 10% of individuals with the issue, manifestations start in the arms or face. As Guillain-Barré syndrome advances, muscle shortcoming can develop into loss of motion. Signs and indications of Guillain-Barré syndrome may include prickling, a tingling sensations in your fingers, toes, lower legs or wrists. Shortcoming in your legs that spreads to your chest area. Insecure strolling or failure to walk or climb steps. Trouble with facial developments, including talking, biting or gulping. Twofold vision or failure to move eyes. Extreme torment that may feel pain-filled, shooting or cramp-like and might be more awful around evening time. Trouble with bladder control or entrail work. Fast pulse. Low or hypertension. Trouble relaxing. Individuals with Guillain-Barré syndrome generally experience their most critical shortcoming inside about 14 days after side effects start. Types. When thought to be a solitary problem, Guillain-Barré syndrome is presently known to happen in a few structures. The principal types are intense incendiary demyelinating polyradiculon neuropathy, AIDP, the most widely recognized structure in North America and Europe. The most widely recognized indication of AIDP is muscle shortcoming that begins in the lower part of your body and spreads up. Mill operator Fisher syndrome, MFS, in which loss of motion begins in the eyes. MFS is likewise connected with flimsy walk. MFS is more uncommon in the US yet, more normal in Asia. Intense engine axonal neuropathy, AMAN, and intense engine tangible axonal neuropathy, AMSON, are more uncommon in the US yet. AMAN and AMSON are more regular in China, Japan and Mexico. When to see a specialist. Call your primary care physician in the event that you have gentle shivering in your toes or fingers that doesn't appear to spread or deteriorating. Look for crisis clinical assistance in the event that you have any of these serious signs or indications. Shivering that began in your feet or toes and is presently climbing your body. Shivering or shortcoming that is spreading quickly. Trouble slowing down to rest or windedness when lying level. Gagging on spit. Guillain-Barré syndrome is a genuine condition that requires quick hospitalization since it can deteriorate quickly. The sooner proper treatment is begun, the better the opportunity of a decent result. Causes. The specific reason for Guillain-Barré syndrome isn't known. The issue ordinarily seems days or weeks after a respiratory or stomach-related clot contamination. Once in a while, late medical procedure or immunization can trigger Guillain-Barré syndrome. As of late, there have been cases detailed after contamination with the Zika infection. Guillain-Barré syndrome may likewise happen after contamination with the COVID-19. In Guillain-Barré syndrome, your resistant framework, which for the most part assaults just attacking life forms, starts assaulting the nerves. In AIDP, the most widely recognized type of Guillain-Barré syndrome in the US, the nerve's defensive covering, myelin sheath, is harmed. The harm keeps nerves from communicating signs to your mind, causing shortcoming, deadness or loss of motion. Hazard factors. Guillain-Barré syndrome can influence all age gatherings. In any case, your danger increments as you age. It's likewise more normal in guys than females. Guillain-Barré syndrome might be set off by Most generally, disease with Campylobacter, a kind of microbes regularly found in half-cooked poultry. Flu infection. Cytomegalovirus. Epstein-Barr infection. Zika infection. Hepatitis A, B, C and E. HIV, the infection that causes AIDS. Mycoplasma pneumonia. Medical procedure. Injury. Hodgkin's lymphoma. Once in a while, flu inoculations or youth immunizations. Coronavirus. Entanglements. Guillain-Barré syndrome influences your nerves. Since nerves control your developments and body capacities, individuals with Guillain-Barré may incite breathing troubles. The shortcoming or loss of motion can spread to the muscles that control your breathing, a conceivably deadly intricacy. Up to 22% of individuals with Guillain-Barré syndrome need brief assistance from a machine to inhale inside the principal week when they're hospitalized for treatment. Leftover deadness or different sensations. The vast majority with Guillain-Barré syndrome recuperate totally or have just minor, lingering shortcoming, deadness or shivering. Heart and pulse issues. Pulse vacillations and sporadic heart rhythms, cardiovascular arrhythmias, are regular symptoms of Guillain-Barré syndrome. Torment. 33% of individuals with Guillain-Barré syndrome experience extreme nerve torment, which might be facilitated with medicine. Inside and bladder work issues. Slow entrail capacity and pee maintenance may result from Guillain-Barré syndrome. Blood clusters. Individuals who are stationary because of Guillain-Barré syndrome are in danger of creating blood clusters. Until you're ready to walk freely, taking blood thinners and wearing help stockings might be suggested. Pressing factor bruises. Being stationary likewise puts you in danger of creating bed sores, pressure wounds. Regular repositioning may help keep away from this issue. Backslide. From 2% to 5% of individuals with Guillain-Barré syndrome experience a backslide. Extreme, early side effects of Guillain-Barré syndrome altogether increment the danger of genuine long-haul inconveniences. Seldom, passing may happen from entanglements like respiratory misery syndrome and coronary episodes.